Air pollution's effect on healthcare expenditure in our country. Examining the profound economic burden of deteriorating air quality on India's healthcare system and exploring pathways towards sustainable solutions. The scale of India's air pollution crisis. India faces one of the world's most severe air pollution challenges, with 21 of the 30 most polluted cities globally located within its borders. Over 1.67 million deaths annually are attributed to air pollution, making it a critical public health emergency. Major sources include vehicular emissions, industrial discharge, agricultural burning, and construction dust. Particulate matter, PM 2.5 and PM 10, levels consistently exceed WHO guidelines by 10 to 15 times, particularly during winter months. The crisis transcends urban boundaries, with rural areas experiencing significant pollution from biomass burning and agricultural practices, affecting over 65% of India's population. Annual deaths, 1.67 million. Lives lost to air pollution yearly. 21 polluted cities. India's cities in global top 30. 10-15x WHO limit exceeded. PM 2.5 levels above guidelines. Direct health impacts, respiratory and cardiovascular diseases. Respiratory disorders. Chronic obstructive pulmonary disease, COPD, asthma, and bronchitis cases have surged by 40% over the past decade. PM 2.5 particles penetrate deep into lung tissue, causing inflammation and permanent damage. Cardiovascular complications. Heart attacks, strokes, and hypertension linked to air pollution account for 28% of cardiovascular deaths. Toxic particles enter the bloodstream, triggering systemic inflammation and arterial damage. Cancer incidence. Lung cancer rates have increased by 25% in urban areas. Carcinogenic compounds in polluted air, including benzene and formaldehyde, contribute to rising mortality rates amongst non-smokers. Vulnerable populations. Children under 5. Developing lungs make them 3x more susceptible to respiratory infections. School absences increase by 40% during high pollution periods. Stunted lung development. Increased asthma rates. Adults over 65. Pre-existing conditions amplify pollution effects. Emergency hospital visits rise 25% during severe pollution episodes. Heart disease complications. Stroke risk elevation. Low-income communities. Limited access to healthcare compounds vulnerability. Out-of-pocket expenses can devastate household finances. Delayed treatment seeking. Poor indoor air quality. Economic analysis. GDP impact, 2.9%. Annual healthcare costs from air pollution. Cost increase, 44%. Healthcare spending rise since 2015. Per capita, 1.7 litres. Average annual pollution-related health costs. Air pollution now accounts for nearly 3% of India's GDP in healthcare expenditure alone, representing a staggering 2.6 trillion Indian rupees annually in direct and indirect medical costs. The economic burden extends beyond immediate treatment costs, encompassing long-term chronic care management, rehabilitation services, and preventive interventions that collectively strain both public health budgets and household finances. Hidden costs. Productivity loss. Sick days due to pollution-related illnesses cost the economy 1.3 trillion Indian rupees annually. Workers in heavily polluted cities lose an average of 15 productive days per year. Preventive care expenses. Families spend 25,000 Indian rupees annually on air purifiers, masks, and supplements. Preventive healthcare visits increase by 30% in high-pollution areas. Educational impact. Children's cognitive development suffers, leading to long-term economic consequences. Special educational support costs rise in polluted regions. These indirect costs often exceed direct medical expenses, creating a cascading economic impact that affects entire communities and future generations.